Plaque's not the problem, it's the thrombus on the plaque. Not all plaques cause thrombus, and not all thrombus have to exist on plaques. And that's a big observation. And there's a shift in how we're thinking about the problems that cause the number one number of deaths in this country and around the world. This is a good example from Rosie O'Donnell, who was a guest on the show, and I would make animations of these people who were willing to come forward, and she was honestly talking about a heart attack she had. There's the LAD, the Widowmaker vessel, by the way. Blood is coursing through that. Now listen carefully. Watch the plaque. It's getting bigger, 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 but that's not the problem. Right here is the problem. See the bottom right starting to rupture? It just burst. The zip basically popped and immediately caused the thrombosis to land behind it. And if I pull out, no blood's passing, so guess what starts to die? The muscle downstream. You're witnessing the leading cause of death. That's a myocardial infarction. And Rosie had no idea it was happening before it started. And by the time she did figure it out, it could have been too late, except she was rushed to the hospital. What's the number one thing we look for in a woman's body if they die suddenly? My pathology colleagues tell me they open their stomach and they look for Pepto-Bismol. They look for purple fluid in the stomach. Because if the woman was taking Pepto-Bismol, she was probably having angina, and she thought it was indigestion. That's why so many people die of heart attacks, because they don't know they're going to die of a heart attack. That becomes an opportunity for us. So how do you deal with it? This is the usual way. You go to your doctor. You all will see people in your life come back to you with numbers. Right? They'll say, I had a high cholesterol. That's like saying, I have money in the bank. But like, how much and where and what kinds of accounts and what kind of returns? You have to ask questions like, is it lousy LDL cholesterol, the healthy good stuff, the HDL cholesterol that rushes in there and pulls away bad plaque? Is it lipoprotein A, which seems to occur maybe as an adaptive mechanism in populations like in Northern Europe where they didn't have enough vitamin C. If you didn't have enough vitamin C, you kept having damage to your arteries, so you had to have a very fast way of repairing your arteries, which is great if you're 20 years old living in in the Ice Age 15,000 years ago. But today, that same overhealing causes sudden thrombosis. And things like coenzyme Q10 and maybe some medications, injectable medications might be helpful. We don't know enough about this, but these are the kinds of places where we have to start playing. Homocysteine, which is the classic ailment we treat with, as you probably all know, high-dose B vitamins. Not even high-dose, just B vitamins. Methylated B vitamins are very effective in reducing homocysteine because it leads to toxic damage of the lining of the arteries. These all matter. Notice, I didn't put cholesterol anywhere on the list because cholesterol isn't the big issue unless you have damage to the artery. Cholesterol is like plaster. Plaster is not bad, but if you have too much plaster, it's a problem. If I punch a hole in this wall back here, how do I fix the hole? I've got to put plaster in there. If I put high quality plaster, the HDL plaster, it's going to make a nice clean return. If it's lousy LDL plaster, you're going to get a cheap spatula that falls out of the hole in the wall. You don't want that. But if you don't have a hole, you don't care about plaster because you don't have to fix anything. So stop making holes with high blood pressure, lipoprotein A, and homocysteine. You won't have a problem. But the most valuable thing we could probably do is look, to actually look with our eyes at what's happening at to the arteries. Can we do that? But yeah. For the last few years, we've started to see new ideas come about that make this possible. Here's my argument. We have to emulate what cancer docs have been able to do. You have a breast exam, basic screening, you have a mammography, right? It works. In heart disease, you look for a surrogate risk factor, like one of those numbers I just gave you. But 70% of people with heart attack have relatively normal cholesterol. Not perfect, but relatively normal, not alarming anyway. You have the same reality when you're dealing with colonoscopy because it finds colon polyps. I had an adenomatous polyp. I have no risk factors, no one in my family's ever had one. I was 50, it was the right age, I got the colonoscopy, and they found a precancerous polyp. Now, it took me about 15 minutes to cure my problem, or my doctor took 15 minutes, but that's the kind of solution we want. In heart disease, we don't have that. You get symptoms, like the women I told you about earlier who end up passing with Pepto-Bismol in their stomach. 80%, rather 50% of heart attack victims, it's their first sign is their heart attack. They don't get a warning. And finally, simple things like screening for lung cancer with chest x-rays and lung CTs. You know, we do stress testing. That's good enough because 75% of heart attack lesions are missed by stress testing. So what does work? This works. These are new generations imaging devices that we've been able to mature. And there are some people out there who are able to use this data very effectively in order to be able to look at the inside of your arteries. Now, let me call your attention to something. Plaques look different. This is an artery, in that top left image. It's the same artery. Some of the plaque is red, some is blue. Blue plaque is calcified. Calcific plaque is a good thing in many ways, because it means your body was trying to heal a plaque. It was trying to stabilize a plaque by reinforcing it with calcium. These plaques don't seem to cause heart attacks. So we don't want to go off and start trying to fix these plaques, because we might cause more harm than good. But if you've got the red plaque, that's a major problem. Those dark red plaques, they rupture, like that video I showed you of Rosie's heart. And that's a problem that we can address. Now, here's the opportunity. Treating those invulnerable, irritable plaques might be done with supplements. It could be done with technologies we haven't invented yet. It could be done with some traditional medications, but that should be our goal. One big message I want to leave you with is the better medicine gets at looking at subtle differences in our health, the more we're going to appreciate what so many of you are researching. The reason so much of what you're looking at hasn't been proven to be effective is we didn't have tools that were sophisticated enough to detect the benefit. It's not that it didn't work. I mean, there's a reason that the MMA athletes and the bodybuilders on the stages today got to the size and the success they were. They tuned up their body, they hacked their biology. But scaling that became difficult because we didn't have the ways of measuring. Now we do. Now we'll be able to say, you should be taking X dose of B12 because we know it'll benefit. Or some other therapy that I haven't learned enough about to discuss. And that's how we'll be able to advance medicine and make it an integrated approach where we all are pulling the oars together. The same goes for detecting ailments and getting people to change their minds. If I want you to change what you're doing with your body, I can show you one of those scans. Or I can show you what a real lung looks like and how beautiful it is and pink and healthy and just a gift. Or I can show you what it looks like if you smoke.